And since our opening speaker gave a powerful, setting the stage that included many of these themes, would like to bring back Dr. Christine Crawford to provide a perspective here, who is an adult and child psychiatrist based in Boston and is, as a reminder, an assistant professor of psychiatry at Boston University School of Medicine. She is also the associate medical director at the National Alliance on Mental Illness. So, Dr. Crawford, are you there?
I am here, and I am just so encouraged by what it is that I heard from all of our panelists today. You're right, Dr. Hill, tying in all of these ideas around storytelling, around how to address inequities, how to address stigma, as well as some of the cultural barriers and other barriers that make it difficult for patients to access care. I was really taken by Dr. Mount's story around talking about the importance of telehealth and creating access to essential mental health supports in communities in which there are tremendous barriers to being able to meet with a therapist, a psychiatrist, to receive that much needed mental health support, as well as talking about some of the cultural biases that he experienced and the stigma having to relate to being a Chinese American wanting to be in the mental health field. And also Dr. Jordan talking about the root factors that impact access to care. And I really was taken by what it is she said about how researchers and clinicians need to not only listen to patients, but listen to themselves as well to see if there's any certain biases that exist within them that may be influencing the way in which they're delivering care to patients. And Dr. Mai Pham, talking about how we need to understand payers in terms of understanding the levers that they pull. And I was really impressed by this notion of really empowering payers to allocate their funds and financial resources elsewhere in order to impact greater change. And Dr. Chang talking about the vision community. And I really love this quote about technology as a way to narrow gaps as opposed to broadening them. So I appreciate the emphasis around stigma, around bias, and around the importance of the lived experience. So I'm really looking forward to the Q&A session with our panelists shortly.
Absolutely, Dr. Crawford. And I tell you, we got one question in already. We had such a vast, presentation from many of these thought leaders.